Can you just leave Medicare Advantage altogether and go back to original Medicare or the supplement plan? Is that an option that you have during the annual enrollment period? Short answer to that question is yeah, it is. And it's something that a lot of people don't think about. They don't really even understand that that's a possibility. And to be fair, it's not always. Let me explain what I mean. So if you've been in Medicare Advantage and you want to get into a Medicare supplement plan, there are going to be some medical questions you have to ask. This is called medical underwriting. And they're going to ask you about your recent health history and determine risk factors moving forward and things like that. The result of that could be that you're not able to make a move to the Medicare supplement plan and you need to stay with a Medicare Advantage plan. However, if the medical stuff's not a big deal, you're pretty healthy, then this is something you could consider. So let's talk about why you would want to consider that, okay? What are the relative advantages of making the move from Medicare Advantage to a Medicare supplement plan? The first advantage, of course, is that you're not going to have to worry about provider networks anymore. Any doctor or provider that takes Medicare at all will take your Medicare supplement plan, full stop, no questions asked. So that's a really nice feature in a world where it seems like provider networks are shifting all the time, right? Second thing is you're not going to have to worry about prior authorizations. In a Medicare Advantage plan, a lot of times to get care, that has to be pre-approved by the insurance company. You don't really have that on Medicare and Medicare supplement plans, okay? And the third thing you're going to see is you're going to have a much lower costs when you access that health care. So you're not going to have co-pays for hospitalizations and things like that necessarily. The out-of-pocket costs are lower. Now, all those positive benefits do, of course, come with a cost. And in this case, it's actually quite literal. The number one reason that people don't make this move is because the cost monthly of getting into a Medicare supplement plan is a lot higher. You have a much higher monthly cost. The amount's going to depend a lot on your age, where you are, that sort of thing. But you're going to have a much higher monthly cost. You're also going to have to pick up a prescription drug plan because that's a separate policy. And if you want dental and vision coverage, you're going to have to get that separate. So you're kind of piecemealing a few things together that are all in one nice, neat package in the Medicare Advantage plan. So is making this move the right move for you? I don't know. It depends a lot on your situation, your budget, your needs. My encouragement to you is to talk to somebody. We'd love to talk to you about it. If you don't talk to us, talk to somebody that's competent and knows what they're doing and can help guide you through the decision so you can make the choice that's going to be the best for you.